Let's keep the conversation in Tanzania and follow on all the stories developing there. The country has, of course, opened its first bone marrow transplant center in the capital, Dodoma. According to the director of Benjamin Mkapa Hospital, Dr. Alphonce Chandika, the opening marks a milestone for the country's health sector and will focus on treating patients with sickle cell. Now, very few countries on the continent offer bone marrow transplants, and only Algeria, Egypt, Morocco, South Africa, and Tunisia have similar treatment programs. Sickle cell is an inherited disorder, and most cases are found in Sub-Saharan Africa and is also caused by a faulty gene that affects how red blood cells develop, and the condition can cause severe pain and organ failure. The East African nation ranks, of course, fourth in the world for the highest rate of sickle cell, with around 11,000 children born with the disease each year, according to Tanzania's health ministry.
Dr. Alphonce Chandika joins us now from Dodoma, Tanzania. Good morning and welcome to Breakfast Central. Okay, it doesn't seem that we are able to connect yet. Whilst we try, all right. Good morning, Doctor. Thank you so much for joining us. Okay, Doctor, we hope that you're able to hear us, and we'd like you to please unmute your device and say something when you're able to connect. But I think that this is certainly a laudable achievement. Many number of people would have been saved if, I mean, we're just having this conversation, was it 2 days ago, about sickle cell disease and how, unfortunately, it's predominantly a Sub-Saharan African disease. And as such, we haven't seen enough advancement in that regard. You know, one of the angles to the conversation we had was, if it maybe plagued the Western world, they would have developed some sort of a cure. And the other angle we had to it was, why is Africa waiting for the Western world to develop a cure? Why can't we find our own means and our own alternatives?
I agree.
And I do think that we've tried in the area of sensitization. It's why people who are unmarried, I mean, back in the day, we had a number of children being born and, you know, dying right after, not too long after. And they called it Ogbanje for those in the western part of Africa, in Nigeria to be precise, it was called Ogbanje. But many years later, we then realized that what they're calling Ogbanje in some cases was sickle cell. Because these children, of course, you know, had to deal with crises that the parents were not equipped to handle. So now people are, you know, looking for more alternatives to be able to handle this. Bone marrow transplant is one of them. You know, stem cell therapy, but there are preventive measures. So the preventive measures,
I get it. But I mean, so there's that angle, you know. But one angle that I would never leave out, you know, in these type of conversations really is understanding, because once again, Tanzania is in the news for something positive and something good. And if you look at the statistics, it says about 11,000, I think, fatalities.
Sickle cell children born every year.
Which is shocking. And of course, you know, it then shows that the government understands what is in high demand with regards to the health sector in the country and has gone ahead to, of course, establish this facility. And that's one thing that I feel is most important in this part. And, you know, that every single government should know what its citizens need or require the most in education, in healthcare, with security, with infrastructure, with, you know, ease of doing business in every single way possible. There should be a proper analysis of, you know, the requirements of citizens in every sector. And of course, that goes on the local government level, the state level, and of course the federal level. And I would always put Nigeria, of course, in the spotlight because that's where we are, that's where we're from. Does the Nigerian government understand what its citizens require the most at this time with regards to healthcare? Is there certain things, you know, with, you know, either infant or maternal mortality that the government has looked at and said, okay, we need to fix this? Are there certain diseases? Are there certain issues in Nigeria's healthcare system that must be fixed or that need to be taken with, you know, utmost, you know, importance that the Nigerian government is, you know, has taken seriously? I can't say so, because the president himself has gone to fix his teeth in the UK.
Very interesting. All right, still talking about this development in Tanzania, let's connect with Dr. Alphonce Chandika, who's joining us now from Dodoma, Tanzania. Good morning and welcome to Breakfast Central.
Thank you. Good morning.
We think that this is an amazing achievement and a laudable feat that Tanzania has achieved, knowing that 11,000 children are born into Tanzania every year with sickle cell disease. You know, tell us about the progress and how this has impacted the health sector. What does this mean for health sector, especially people living with sickle cell disease in Tanzania?
Thank you very much. Actually, this is an excellent milestone in our country. because the government has been spending a lot of money sending patients abroad for treatment for services like bone marrow transplant for patients with sickle cell disease. So the government invested in making sure that these super specialty services which are lacking in the country, they're established. So Benjamin Mkapa is one of the hospital which has been capacitated by the government to start up this program of transplanting bone marrow. As you mentioned, the statistics that we have got a huge number of children born with sickle cell disease in the country. Actually, we are ranked the fourth country in the continent, in the world, to have many children with sickle cell. So, starting up these services at Benjamin Mkapa, which is located in the central part of the country, Dodoma, it will bring now, a brighter future for these children who are born with sickle cell, because by doing bone marrow transplant, basically we are curing the disease and improving the quality of their lives. And as if you followed the news yesterday, the parents, gave testimony that with having children with sickle cell, they spend most of their time in hospitals, admitted on and off, and then they are not able to do their daily activities, and which impact also on their economics, but also economy of the country, because they are not productive most of the time they're admitted. So meaning that starting up these services here, we're gonna improve quality of life of sickle cell patients, but also give time to the parents to ensure that they participate in economic activities at the level of the family, but also at the level of the country. But if you look, in this part of the continent, basically Tanzania is becoming the first country to invest and bringing up this kind of services. So in the east and the central part of Africa, basically we are the first center to start these services. So we also help other countries around who have been also suffering with this kind of a disease and sending patients abroad, so they can as well bring them here and treat them, but also build capacity to those other countries if they're interested in such starting such kind of services. Yeah, so
All right. Now I want to talk about affordability, because we should commend this. It's a huge milestone, for Tanzania, and of course, I'm sure it would also attract medical tourism from different parts of the continent. People who would like to also access this, health facility in Tanzania. But I want to talk about how affordable it is for the thousands of Tanzanians who might be dealing with sickle cell, and of course, those who would need this, health assistance as quickly as possible. Can they afford it? Is the government also making plans to subsidize this treatment?
yeah, for sure, the cost is really high for a normal citizen. But, the health of the citizen is the responsibility of the government in power. Actually, since we have been using a lot of money, like if you send such kind of a patient, we have been sending patients abroad. And that money which we have been using, sending patients abroad, probably one case, if you treat it abroad, when you do it here in the country, probably we are treating 5 or 6 cases. So meaning that we will start with the little money we have been using, treating abroad, to treat our own people. But as what we realized also, the cost of these services being high, not only the procedure, but the medicine and the consumables. So we are looking at the possibility of getting these medicines other than using this middlemen, because we are procuring from the suppliers, the local suppliers, who are inflating the cost. We are looking at the possibility of going to the manufacturers through our medical store department, and probably can get them at a cheaper cost, which in turn will reduce the cost of these procedures. But to start with, it's a government responsibility. Even these few ones we have done, they are being covered by the government. So basically, the government is looking on how it can come up with a fund to help its own citizens as a policy of the country, because like the under 5 by the policy of Tanzania, they have to be treated free of charge, meaning that the government has to bear the cost of those many patients.
I think from here on the final note would be the accessibility of information. How much information is put out in Tanzania about sickle cell disease and the prevention of sickle cell disease? We have the World Sickle Cell Day coming up on the 19th of June. So how well would you say that your country has fared in terms of giving out information to help people in terms of genotype testing and the likes?
Yeah, of course, we continue educating the community. I mean, like what we did yesterday, the Prime Minister also, talked about it, that the community should be aware of the disease, the way to prevent it, like people doing screening before engaging into marriage so that they know their status before doing that. And our laboratories are capable of doing that because we have the HB electrophoresis in multiple hospitals in this country. So it's really very possible for people to do screening before they go into marriage. But also we have got associations of sickle cell, which they organize themselves, and they go to the community, and through media they educate the people on how to take care of patients with sickle cell, but also how to prevent, including educating people on doing screening before engaging into marriage. So the education part is the ongoing process, and even what happened yesterday still is an educative approach, and the Minister of Health continues to encourage people to do screening through different forums, but also we have got special clinics for this patient with sickle cell, and the government, like they support in the provision of drugs which minimize the complications like hydroxyureas, which are available in multiple sites in the country, and they are subsidized by the government, and now they have been included in the national health insurance package so that people can really access them. So education, prevention is part and parcel of the ongoing activities in the Ministry of Health in this country.
All right. Dr. Alphonce Chandika, thank you so much for your time this morning. We look forward to seeing more positive news, as usual, from Tanzania.